My name's Jez Hall and I facilitated the Care at Home inquiry. Shared Future brings together people with different knowledges, different experiences, and through the facilitation that we do, we help them come up with the solutions that will solve their own problems. Whether they're a commissioner struggling with the complexity of the public sector budget, whether they're somebody living in a rural location or an inner city area without many resources, feeling isolated and alone. We bring people together and through that co-create better solutions to intractable problems. Social care in Greater Manchester is pretty much broken. There are many older people who are being bed blocked in hospital, who are living in isolation and loneliness, and somehow, despite all the money that's going into these services, there seems to be a failure to really listen to what is important to the individual and then put in place the infrastructure that will allow them to stay at home safely. So we wanted to do this inquiry really to try and affect how commissioning of health services, that's hospitals and GPs, are being funded. And we also wanted to make sure that that joined up with what was being done by local authorities in terms of the care workers that go into people's homes, the housing that is provided for them, the public transport that's available for them. Because providing care at home is a whole ecosystem of different people who have to come together to support that vulnerable person in the middle. When we talk about care at home, it's like a bundle of wool that's around the person and everybody's pulling on the different strings. And all that's happening is in the middle, the person is getting tied up in the system. So we hope these recommendations will allow us to untangle some of that. We really want it to shift the focus from sticking plasters on crises towards prevention and actually understanding what living well at home really means. It could be a care home, it could be the person's own home, it could be the home of family and friends. That sense of the dignity of life and having a full life and really enjoying life rather than being a part of a system which is just absorbing resources. Remember that at the middle of all of this there is a person with distinct and unique wants and desires and likes. The system must be responding to them rather than they responding to the system. Challenge into Care at Home was an inquiry into what it would take for people to be able to live well at home for as long as they choose. We started through recruiting people who work within the NHS and within social care who had a professional interest in care at home, and we brought them together to deliberate over 6 evenings about the question, the challenge that had been set, what would it take for people to live well at home for as long as they choose. They also heard from people with lived experience of care at home. And then through a facilitated set of conversations, we came up with 12 compelling recommendations to enable people to live safely, well and happily at home for as long as they choose. After we've completed the inquiry, we put together a report. It's really important that we don't interpret what went on in the inquiry. We really only report the words of the participants. What we do describe is the process by which they came to their 12 recommendations. So we will describe the sessions that ran, the commentators that they heard from, the questions they asked the commentators. They then produce a set of recommendations which they prioritised, and all of that goes into the final report, a document that we produce. That is the what and the why things need to change. At the launch event, we present those recommendations and people then start to discuss the how they might be implemented. On Wednesday, the 12th of December, we held the launch of the report of the inquiry. We had about 40 people turn up, people from the health and social care sector. We had participants in the inquiry. We had commentators who had provided evidence and ideas into the inquiry. And we had a really participatory workshop where we looked through all the recommendations and came up with additional ideas about how those recommendations could be implemented. We started off with a presentation from Mark Fitton, who's a Director of Adult Social Services for Stockport Council, talking about what the Health and Social Care Partnership that is trying to transform care at home is doing themselves. And then following that, we had all of the participants who had been involved in the inquiry reading out the 12 recommendations. When people came together, they sat at tables of around 10 people, and they each tackled one of the themes that we had raised, and for each recommendation they were thinking through who needs to be involved in this, what resources are needed, and resources is not just money but it's time and skills and passion, who needs to lead on it in order to affect change, and most importantly, how can everybody get involved in solving this problem. But what was really apparent was that people were spending a lot of time telling their stories, because everybody's got a story of a family member who needs care at home. So it was really great to see the emotional interaction between people, as well as people working towards some set of goals, some set of outcomes, some set of recommendations that could really be implemented. One of the things the system's really keen on at the moment is social prescribing. That is GPs prescribing activities for people to keep them well. But unless there are resources going to the groups that are providing those activities, it's just social pointing at stuff. Care at home is not just about the professional, it's about the whole community caring for that individual, and that includes voluntary sector organisations who are really struggling for funding. We can't keep providing the services in the way that we want. We can't afford them. It can cost £1,000 a day to keep somebody in hospital. We really need to change the system into one that is preventing problems, not putting expensive sticking plasters on them. And that means we need leadership from the top, we need leadership from GPs, we need leadership from commissioners, and we need to join up people involved in housing, involved in transport systems, involved in the funding of the voluntary sector, a clear strategy for actually solving what is one of the biggest societal problems, that an increasingly elderly population needing more care with less people to fund that care through taxes. By the end of the launch event, it was really clear how close the outcomes of our inquiry were to the conversations that are happening within the Commissioner's offices. People know what needs to change. We're going to have further meetings. We're going to keep on with this because we found that it's a valuable process. Not only the recommendations, but the process itself. So we're going to also try and see if we can sell this inquiry model of bringing professionals from all sorts of different sectors together, all sorts of different seniorities, break them out of their silos and start working together collectively as they should to solve one of these really intractable problems. In this case, care at home. It could be homelessness. It could be any social problem where the individual in the middle is getting lost.